Homeopathic Clinics, Session 3. In this session, we are going to discuss the cases of acute pain, which is common problem in day-to-day practice. Now, I will start with my first case. 30-year-old female came with a complaint of pain at inferior angle of left scapula since 8 to 10 days. She told pain occasionally radiates towards the abdomen, towards the chest, with the frequency of 4 to 5 times in a day. During pain, she feels better by bending backward. Along with pain, she started with eructations since 8 to 10 days. So before thinking of homeopathic remedy, we have to think why pain at inferior angle of scapula. Usually, the pain at inferior angle of scapula occur because of weakness of stabilizers of scapula, like serratus anterior or rhomboid muscles, which is commonly occur because of wrong posture, and the differential diagnosis would be shoulder pathology or cervical spondylitis. But in this case, because of wrong posture only. Now, homeopathic point of view, the location itself is a characteristic. So, by looking into the Kent repertory, under the back section and the rubric pain, dorsal region, scapulae and sub-rubric angle of inferior, and bending backward amulets in Phatak repertory, I found two remedies, chelidonium and rustox. But as the pain is associated with eructation, I prescribed chelidonium 1 mg 6 Rb for 3 days. After 3 days, pain is reduced to considerable extent with decrease in gases also. So I continued the same medicine for 3 more days and patient was alright. Now I will start with the second case, which is interesting one. Female brought her 3-year-old boy and she told, my child is complaining of pain in abdomen since 2 to 3 days, and during pain he bends double and sits like this. On further inquiry, I found child was passing hard stool which is in small pieces since 1 month. On examination, there was mild tenderness in right and left iliac region with no other specific finding. So, by referring Kent repertory, under the abdomen section, bending double must and stool Shibdung-like in Phatak repertory, I prescribed Colocynth 1 mg and Nitramute 200 alternatively for 2 days. Colocynth to relieve his pain and Nitramute as his constitutional or chronic drug to relieve the constipation. But patient did not follow after 2 days. Her mother directly came after 1 month and she told in between they went to the pediatrician and he did all the investigation including CT abdomen also, and all the investigations are normal. And she told, but still my child is getting pain and constipation also persists, and now frequency is increased to 10 to 12 times in a day. So I examined the child again. There was mild tenderness in right and left iliac region that was earlier also, with no other specific finding. So I concluded the child is getting pain because of intestinal colic, and which is because of constipation only. So again the reference to the Kent and Phatak repertory was made for the same rubric, bending double amulets and Shibdung-like stool. The two remedies came to my mind, that was plumbum med and opium. But opium is more often comes with the concomitant of paretic or paralytic effect, like constipation associated with paralytic ileus, or it is associated at old age. So I prescribed Plumbum 200 3 times a day for 3 days, and after 3 days her mother told, my child is much better and now he is passing soft stool also. So I continued the same medicine for next 4 days and the child became alright. I would like to mention here, in cases of pain, try to find out the cause of pain, which will help us to select a remedy. Now I will proceed to case number 3, which is of 21-year-old boy who came to our center with the complaint of pain at right renal area and which is extending towards the abdomen near the lumbar region. Along with pain, he started with the burning micturition, which is before, during and after urination. He was not relieved by the modern medicine, so he came at our center. His sonography report was suggestive of 7.7 mm calculus in right lower ureter and 2 calculi in right renal pelvis measuring 4 mm and 4.5 mm in size. After taking history and looking at report, I concluded it is a renal colic. So, by referring Kent repertory under the kidney section, rubric pain kidney region of extending to ureter, there are 4 remedies, but Cantharis was covering the concomitant symptom, that is burning micturition before, during and after urination also. So I prescribed Cantharis 1 mg 6 hourly for 3 days. After 3 days, his pain was reduced, with burning micturition was also less. So I continued the same medicine for next 2 days and pain completely subsided after 5 days. And afterwards, I treated the boy for renal calculi. Now, I will start with my last case, which is of 35-year-old female. She came with the complaint of pain in lower abdomen since 8 to 10 days, and she told, my pain is of shooting character which comes suddenly and disappears also suddenly, and during pain she feels better by pressure, but the frequency of pain is 20 to 25 times in a day. So I examined the patient. There was no tenderness, there was nothing specific finding. Her urine was normal, her stool was normal, and before coming to me, she had been went to a physician, and the physician advised sonography, and sonography report was also normal. As the cause of pain is very difficult to diagnose here, I presume the cause may be of spasmodic origin, and by looking into the Kent repertory under the generality section for the rubric pain appears suddenly and disappears suddenly and pressure amulets in Phatak repertory, 2 remedies came for the consideration, Restox and Macphos. But Macphos is a more spasmodic remedy. I prescribed Macphos 1 mg 6 hourly for 3 days. After 3 days, she told, I got 1 episode of pain which is of milder intensity. So I continued the same medicine for 3 more days and patient became alright. Now I will finish with my cases of pain. Dr. Ashok will present you the cases of pain. Thank you.